I don't really do the standard type cosmetic work because I've never really been sort of your standard doctor. Like liposuction, the traditional liposuction that you normally think about.
Yeah.
It was developed in 1974.
Wow.
You know, it's 50 years old.
Very outdated.
So why would you use a procedure that's 50 years old? I wouldn't do it on myself, so I wouldn't do it for my patients. It wasn't until 2006 when the laser lipo, when smart lipo got FDA approved, and my ears perked up.
Okay.
And I thought, oh, well, this is very interesting. And that's when I started looking into it. And that's when I got into liposuction, was in 2007. I never have in my entire career, in nearly 10,000 patients that I and the doctors that I've trained in my technique have performed since 2007, we haven't had one single incident.
Wow.
Not one. If it's not good enough for me or my family, why would I offer it to my patients? Every doctor should be thinking like this.
I can't wait for everybody to hear what you've been up to.
Thank you. Well, my office in, I guess one is Los Angeles, which is sort of Beverly Hills and Encino, because LA is so big.
So big.
And then one is in Newport Beach,
Mm-hmm.
and mostly cosmetic. And it's been great, very popular.
Yes.
And I don't really do the standard type cosmetic work because I've never really been sort of your standard doctor. It's kind of boring for me.
Too conventional.
Yeah, the textbook stuff. I realized early on in my medical career that what's in the textbook is so outdated. I mean, when you think about it, it's like 20 years old.
Yeah.
So I've always liked cutting edge, innovative technology. That's where my passion has always been. And I've kind of been sort of like a go-getter and tech guy. And so for me, it's always been about, like I always say, I want tomorrow's treatment today.
Yes, yes. What's it called? The advanced technology in is it
Ultrasculpt? Right.
Yes.
Well, that's my trademark name for it. Well, yeah, it's my name for the way my liposuction sort of technique. Because if you think about it, like liposuction, the traditional liposuction that you normally think about.
Yeah.
It was developed in 1974.
Wow.
It's 50 years old. That's half a century.
Yeah.
So would you wear clothes that's 50 years old?
No way.
Would you drive a car that's 50 years old?
Very outdated.
Even antibiotics, like very few antibiotics that you use today are 50 years old.
Yeah.
So why would you use a procedure that's 50 years old? It's so outdated.
Very true.
And so when I first got introduced to liposuction, I wouldn't do it on myself, so I wouldn't do it for my patients. It wasn't until 2006 when the laser lipo, when smart lipo got FDA approved, and my ears perked up.
Okay.
And I thought, oh, well, this is very interesting. And that's when I started looking into it. And that's when I got into liposuction, was in 2007.
Mm-hmm.
Because then I started doing all the research and saw how much things had advanced since 1974. And then that's when I became interested. And I put together my Ultrasculpt procedure, which is a far more advanced version of the traditional liposuction technique.
With laser.
Laser's part of it. See, that's the thing. Traditional liposuction is general anesthesia, big giant cannulas that are the size of like cannons that are very harsh and destructive on the tissues of the body. Yeah. This is why they're so painful when they're done. After they're done, patients take a long time to recover. They're fraught with potential side effects. Sometimes you can get very uneven, not very natural looking results, wavy, lumpy bumpies, and things like that. Nothing to tighten the skin. Mm-hmm. So what I put together in 2007 and have kept improving and evolving since 2007, because I don't want to be stagnant and not evolve with the times, is Ultrasculpt, which it's all local anesthesia, not general, and small little cannulas that are smaller than coffee stirrers.
Really?
So they're much more safe for the body, less damaging to the surrounding tissues, no collateral damage.
Yeah.
So patients recover faster. Mm-hmm. It's safer, more natural looking results. And then using the new energy devices that have come out in the last 20 years, like smart lipo laser, and now the new radio frequency devices like InMode's Body Tight, and now the one that just came out this year, which I just got, by the way, the Quantum.
Quantum?
Yeah.
What's the difference?
Well, it's bipolar radio frequency, so all the energy stays very, very concentrated in a very small area, so it doesn't dissipate throughout the body. So again, it's very safe, it's very focused. You're not getting energies going all over the body, so it stays really focused right where the doctor wants it. And the device itself has built-in thermistors that measure the heat. So I'm very experienced. I would never get a burn. I never have, but newer doctors who aren't very experienced, sometimes human error can creep in there. Well, the machine itself has a built-in safety features so that if the temperature gets too high, it'll shut itself off.
Oh, nice.
So it's safety, 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 right?
Yes.
So Ultra Sculpt that I came up with it's enhanced safety, far faster recovery, and more natural looking results. My patients are back to work in 24 to 48 hours.
Wow.
95 to 98% of my patients don't take narcotics more than a day, if even that. Within a week, 98% are not taking anything, not even Tylenol or Motrin.
Wow.
Not like the liposuction you're used to hearing about, is it? Right?
Yeah. So does the laser and the radio frequency help break down the fat?
Well, they do. They do, melt fat and kill the fat cells. But mostly they're cauterizing everything.
Okay.
So by cauterizing everything, infection is pretty much unheard of. Bleeding is unheard of. Seroma, which is an accumulation of tissues, of fluids. I've never seen one, ever.
Wow.
Now, a lot of doctors have. I never have in my entire career. In nearly 10,000 patients that I and the doctors that I've trained in my technique have performed since 2007, we haven't had one single incident.
Wow.
Not one. Like nothing.
That's amazing.
So the proof is in the pudding.
Yeah. Yeah.
So what do you want? The old traditional liposuction, or do you want, the new advanced evolved procedures?
And I feel like that's what they're doing in the other countries. A lot of women are flying out of the country, but they're dealing with the old traditional liposuction.
Right.
And they're only going there because they think it's cheaper. But, who knows? And it could be dangerous too.
Well, anything that I look at to bring to my office, I sort of put through a challenge test. First of all, safety first. It always has to be safe. Now, what do I mean by that? It has to have side effects that are very, very tolerable. In other words, bruising or things that are temporary. They'll go away. Nobody cares about it. Maybe a little bit of discoloration, it goes away, it fades away. Nothing permanent. No one cares.
A little scar,
a freckle scar. Well, we all have little freckles. Nobody cares about those things. Okay, I can tolerate that. Number one, safety first. This is cosmetic. You don't want to put life and limb on the line for something that's elective. So always safety first. That's my first challenge test to anything I want to bring to my office. Second, it's got to be effective. It's got to be efficacious. I don't need a line of patients out the door who are upset because they spent all this time and money and didn't get results. I don't want something that's only effective for 30% of my patients or even 60% of my patients. I want something that's effective for 90, 80, 90% of my patients. The majority of my patients need to see good results. And then the final thing is, if I wanted that done, would I be willing to do it on myself or my family? If it's not good enough for me or my family, why would I offer it to my patients?
Exactly.
Every doctor should be thinking like this. And so if it doesn't meet that challenge test, it's not coming to my office. And believe me, every year, every month, I have reps come to my office with these new technologies and
new devices.
It's mostly junk. It's mostly garbage. Cool sculpting.
Oh.
Don't even it's garbage. It's a waste of time and money. I get patients every week coming to my office who've tried it and they didn't get any results, or worse, it created a big, large, hard bubble of fat. Now I got to fix it for them.
Like some hardening, I heard.
Yeah, because
there's lawsuits involved.
PAH, paradoxical adipose hyperplasia. A hard fibrotic bubble of fat that now I got to work harder to try to get rid of for them.
Oh, really?
Yeah.
It's kind of like nip and tuck. You got to fix the problem.
Well, it's a lot more than just nip and tuck. It would have been easier if they just came to me to get rid of the fat in the first place. Yeah. I charge extra for it. It's more work for me.
True.
It's fibrotic fat. It's scarred up fat.
Oh, geez.
Yeah. Okay. Kybella is another one. Garbage.
Kybella.
In 2004, I tried mesotherapy, which is all these different fat-dissolving agents. You inject it into the fat, try to dissolve it. After 6 months, I realized it doesn't work. It's junk. I threw it away. Said, forget it. I'm not offering this to my patients. It's garbage.
Yeah.
And then they took it, they repackaged it and said, hey, here, it's Kybella. We're going to offer it to patients again.
It's the same thing?
It's the same darn thing.
Oh, my gosh.
Didn't work in 2004. What makes you think it's going to work now?
What are the complications of Kybella?
It's garbage. Well, mostly waste of time and money, but the same thing. It causes fibrosis.
Like hardening?
And scarring, yeah. It doesn't really work. It's a waste.
Okay, good to know.
Yeah. What they did is they took the vehicle that all those medicines came in, which was composed of biliary salts, the bile your gallbladder produces. Yeah. They said, oh, this is what dissolves the fat. Let's use this.
Oh.
It was garbage. It's junk.
Okay. Wow. Good to know. And I think you've recently gotten to like hair technology.
Well, not recently.
Not recently?
To be honest with you, I've been in the field of hair restoration for a very long time. I was very vested. I'm a guy.
Yeah.
So, at 31, 32, I started noticing a little bit of thinning, and I went crazy. And oh my God, what's going on? And so I started looking at what's out there, and what was out there at the time was nothing worthwhile.
Yeah,
nothing
minoxidil. Maybe.
That's about the only thing that was available back then. And so I started poring over the research and started looking at what was out there. And I remember distinctly, I was at a conference. It was 1993. I was a student, and I was at a conference for a prostate drug called Proscar, which is finasteride, 5 milligrams.
Okay.
And the doctor who was giving the lecture said that the mechanism of action is that it blocks the conversion of testosterone to dihydrotestosterone. Well, right away, I was like, oh, wait, what? Raise my hand. And I said, wait, if this blocks the conversion of testosterone to dihydrotestosterone, and we know that male pattern baldness is related to dihydrotestosterone, shouldn't this help with hair loss? And the doctor, the lecturer, said, I don't know. I mean, he was at a loss.
Yeah.
This is before the internet was huge. So I write to the company. I type a letter.
Yeah.
I write to the company. And they sent me back this big packet like this thick. And of course, the first cover letter says, we cannot make any claims, FDA stuff.
Yeah.
But here's our macaque monkey studies. And it was all these studies that said finasteride grows hair like crazy, if you use it. And I was like, oh, wow.
Wow.
And so I started getting compounded capsules of 1.2 milligram finasteride for myself and for my friends and patients and things.
Yeah.
And this was about 4 or 5 years before Propecia, which is 1 milligram finasteride, got FDA approved.
Wow.
So I was about 4 or 5 years ahead of the curve
of
Propecia getting FDA approved.
So it's no longer a black label use.
Well, it's no longer off-label.
Off-label.
Yeah, Propecia is now FDA approved. So I was using Propecia half a decade practically before it got FDA approved.
And
then what's that?
Is it prescription only now?
Well, it was always prescription only. Still is. But that trend continued, and I kept on looking and researching and looking and researching. And then eventually in 2004, I said, oh, look at this medication that we use for this other thing. Its side effect is that it grows hair like crazy. Why are we not using this medicine for hair loss? And sure enough, in 2008, it got FDA approved for eyelashes.
Really?
Yeah.
Remind me the name.
Latisse. So 4 years before Latisse got FDA approved, I was talking about why are we not using, Lumigan which is for glaucoma. Why are we not using this for hair loss? Now, Latisse is 0.03% by Mataprost. My hair formula, HARE, hair accelerated regrowth,
Yes.
by Mataprost is one of the active ingredients, but not at 0.03%. That's a drop in the ocean. 1%.
Really?
Do you have any idea how expensive that is? Latisse at 0.03% is $150.
Yeah.
At 0.03%, I have 1% in my hair formula. And that's just one of the active ingredients to grow hair. My hair formula has 4 ingredients in it to regrow hair. All of them active, and all of them proven in studies to regrow hair like crazy.
So tell us the 4 ingredients again. Or are you not allowed to?
No, I can tell you it's patent pending, actually.
Okay.
It's by Mataprost. There's a jack modulator in here. By the way, I've been doing this since 2008. A few years ago, a jack modulator just got FDA approved for alopecia areata.
Wow.
So again, 2008, 2021, 22, that's how far ahead of the curve I was back then.
Yeah.
Melatonin. Yes. Topical melatonin has been proven in several animal studies and human studies to grow hair like crazy.
Topical, not oral.
Topical.
Oh.
Topical, yeah.
Okay.
Yeah. Copper tripeptide has been shown to grow hair like crazy topically. Now for the men, I custom make this for men and ladies.
So they're different.
Yes.
Okay.
Yes. Everything's custom made for my patients. For the gentlemen, I'll use topical finasteride because that does work, but not for the ladies.
Really?
You can't use it for the ladies.
Why?
Well, especially ladies who are still in the ages where they can have children.
Oh, okay.
Yeah, just in case. Safety.
Yeah.
Safety.
True.
Always safety first.
True.
So for the gentlemen, I'll use the finasteride, but not for the ladies topically.
Oh, wow.
But yeah, my hair formula is unreal. I've grown hair on 70-year-old men. It's crazy.
So you've already started selling?
Oh, since 2008 I've been using it. But it's been evolving. It's been evolving. I've been improving the formula like every so many years. I've been making it better and better and better and better. This past year, I started using the Alma-Ted machine. Now, Alma-Ted is a company. They have they use their machine with copper tripeptide, over-the-counter type of formula, which is fine.
Yeah.
But their machine combined with my formula has been phenomenal.
What is this machine? Is it?
It's a low-frequency ultrasound machine that actually opens up channels on the scalp, so the formula just goes in deeper. The thing is my formula is great, and it works fantastic. But, look, I'm a human being, so I know how human beings think and behave.
Yeah.
And, I've been in bed and said, oh, God, I forgot to use my hair formula. Oh, I'm so tired. I'm so lazy. I just don't want to get up and use the formula.
Yeah.
And so I know my patients are the same way. You're going to use this thing every night, but then what? For the rest of your life, for 20 years, for 30 years, at some point, you're going to just say, I can't use it anymore. So I wanted to come up with a way that patients would be able to do this in short bursts and not have to do it every night. And the Alma-Ted machine was a great way to do it. They can use it for 3 months, not every week. Just use it for a short burst.
Yeah.
For 3 months, grow their hair like crazy, and then just come into the office like every 6 months and just get
afterwards
a maintenance. Yeah.
Oh, and you have this machine.
Yeah.
Wow.
It was an experiment. We tried it out. It worked great, and it's been fantastic.
Is it a handheld machine that you just?
Yeah,
or
it's
is it like
small,
a hat.
it looks like a little pad machine. You just use it on the scalp. You open up the channels. You use the formula. You use the machine to drive the medicine deep into under the skin. No needles, doesn't hurt or anything. It's just look. I fall asleep when my staff is doing it for me. It's really soothing.
No needles.
No needles. No nothing.
Oh wow.
Yeah, it's very comfortable. It's low frequency ultrasound like you use when you're looking at a baby or your gallbladder or something. No pain.
Okay.
No nothing.
Not too expensive.
No. Well, I mean, it's the same as the formula would cost if you use it all year, let's say, or something.
True.
Or something.
And
But the thing about the hair formula is this. Your hair, right, it goes into rest phase and then growth phase and then rest phase and then growth phase, right? Okay, so when it goes into rest phase, if it stays in rest phase, okay, now you're going bald because it's not growing. When my formula pushes it back into growth phase, well, the nice thing is after a certain amount of time, that it's in growth phase, it doesn't suddenly jump back into rest phase. So after a certain amount of time, you don't need to use it every single day or every single night. You do that for a while, like a year, but after a while, you don't need to use it every
Maybe
single.
once a week.
Yeah, I'd say like twice a week or something.
Twice a week.
Yeah, so a bottle will last you forever.
Wow. So it's available now? Like if
Well, you can't just get. You have to get you can only get it with a prescription.
Yeah.
There are a couple of doctors who buy it from me and they give it to their patient. You only get it through a doctor.
But you are offering it to your patients
Of course,
now.
of course. But they have to be evaluated, and you can only get it with a prescription because 2 or 3 of the ingredients, depending on what formula I give my patients, are prescription strength, prescription level medications.
Oh,
Melatonin's over the counter, but the others are not. They're prescription level medicines.
How's the pricing on that?
It's not cheap. It's not going to break your bank, but it's not cheap either. I mean, you're looking like $249 for a bottle.
Okay, and how many pills in the bottle?
No
30?
No pills. It's liquid.
Oh wow.
Yeah, it's liquid. You use it topically.
Okay. And the only difference between the male and the female is no finasteride.
Correct.
Okay.
Some men request no finasteride either because they're worried about like sexual side effects. Which, quite honestly, that's overhyped. But whatever makes them comfortable.
Yeah.
I try to explain to them it's overhyped, but if they really have strong feelings about it, fine. I won't put it in there for them. I can custom make it however they wish.
Wow.
It's compounded.
Okay.
Yeah.
Hair, Hare.
Hair accelerated regrowth.
Wow. Congratulations. You're such an entrepreneur. You have 2 locations. Are you looking to open up another one?
It's if I guess I could. It's tough because I've got to train doctors. They got to do things the way it needs to be done.
And you can't be in 3 places at once.
No.
Yeah, I feel like the one in LA depends heavily on you.
Of course, yeah.
You're like the face of the company.
Well, no, I've got doctors trained though in my technique who do things the way it needs to be done, which is great.
Oh, wow.
There are a lot of doctors who I've trained who just can't pick it up.
Really?
Yeah. This is not about doing things the traditional way. It's not. My tummy tucks, they're done in a local anesthesia.
Wow.
I'm sure you've heard, the whole tummy tuck, patients for months, in pain.
Yeah.
My patients don't take narcotics past like maybe a day or 2, if even that, after their tummy tucks with me. I'm not kidding. In a week, they're driving in 2-3 days. They're showering in a day or 2. Their pain level about a week out with me is maybe a 2-3 out of 10.
Wow. Yeah, some of my girlfriends, honestly, they've been to like Colombia for those procedures, and they have to stay out there for a total of 3 weeks for post-op care.
I don't have any of that.
Yeah.
None of that.
That's amazing.
I don't know. Well, I'm on the faculty of the American Academy of Cosmetic Surgery and the American Society of Liposuction. Quite honestly, in 2025, I'm going back on the lecture circuit. I'm just going to start lecturing and campaigning heavy on this.
Yeah.
Because to me, it's just insane that doctors are not doing it this way.
Yeah. A lot of people
again,
are
the proof is in the
uninformed.
pudding.
Yeah. Yeah.
I really think that it's a disservice to their patients to not be doing it this way. I know why some of them are not doing it this way, because it behooves them.
Oh, okay.
Yeah. Well, when you do general anesthesia, the procedure goes a lot faster, which is great for the doctor, but not very good for the patient.
And it's more expensive for the patient.
Well, that's what I'm trying to say. Are you there to service the patient, or are you there to service yourself?
Yeah. Yeah, you're right. You're right. This is why I like him so much. He, on a personal level, he will tell you what's good for you, what's not good for you, what you need and what you don't need, what's not necessary. He's not out there to make money, and
Well, I'm notoriously known for turning patients away.
Yeah.
Saying, no, stop that. Don't waste your time and money.
Exactly. Yeah, you don't need it. But I want to do the hair formula because I notice my hair is thinning. Not that I'm losing hair. Well, I do lose hair, but it's thinning and I don't like it. So you think it'll work for me?
Hopefully. I mean, nothing's 100%, but I don't see why not. A lot of ladies have used my formula and they've grown hair like crazy. There's a lovely lady, a dentist that I share an office with in Beverly Hills, Dr. Lale. unbelievable work she does with veneers. No prep veneers. She doesn't shave anything down, nothing. Oh, man, her work is unbelievable. And, she was asking me for some of her patients, and some family members. I actually just compounded some bottles for her. Same thing, female family members.
Wow.
Yeah, so... But yeah, I'll get some bottles.
Of course. I can't wait. I mean, I've tried biotin pills, and it's like outdated. Right?
That is based on a study that is very skewed. Yeah, that's
really overrated.
Don't even go there.
Good to know. Good to know, because it's tedious to try to remember to take that.
Yeah.
I'd rather take something
you're not deficient.
Okay.
It's not going to make any difference. Yeah.
Okay. Interesting.
No amount of over supplementation as biotin is going to suddenly grow your hair for you.
Yeah.
It doesn't work that way.
Yeah. I was excited to have Dr. Robert on because he recently started his own show podcast, and he's just a natural on camera. I've had the experience of working with him directly, personally, and also on his show, and I am so excited for you to see his content. It's already out there. He's natural on camera. You would love to have him as your doctor. Anything new on the horizon that we can look forward to?
Well, I mean, mostly I'm just trying to, get information out there. It's been very frustrating for me throughout the years because there's just so much real science out there that's either stifled or not really publicized. Like recently, I just did a thing on there's a medication called Vistide. I worked on it in Belgium again back in the early to mid '90s in Belgium, and it is the magic bullet for DNA viruses.
Oh,
when penicillin was first discovered, they called it a magic bullet. It's killed bacteria, right? Well, Vistide is the magic bullet for DNA viruses. So what are DNA viruses? Herpes, cytomegalovirus, human papillomavirus. It got FDA approved in 1997 for CMV, cytomegalovirus. But I started using it off-label for human papillomavirus, which is the virus that causes warts. In fact, I helped George Washington University Hospital, where I went to medical school, develop a tertiary care center for respiratory papillomas for children and for adults. That means the worst of the worst cases would go there and be treated and be cured. So normally what doctors would do is just laser, and all that would do is just create scar tissue, and people, it didn't help. For some people, the warts just kept coming back. The papilloma tumors, benign tumors, but they would just keep coming back and coming back and coming back. This drug kills the virus without any sequelae, no scarring, nothing. And I started using it there. I developed that tertiary care center with the ENT department at GW, and then I also started using it in my private practice. I cannot tell you how many people I have helped. Some that come to mind. There was a 28-year-old young lady, beautiful girl, an actress in Hollywood, who had plantar warts that had been bothering her whole life since she was 14 years old. She had done everything, burning, freezing, everything, salicylic acid. Nothing helped.
Yeah.
I injected her once with the medicine. Gone.
It's an injectable.
Well, you can make an injection, a cream, whatever.
Okay.
I injected it once, gone. Her papillomas disappeared. Her warts went away. Her plantar warts went away, never came back.
Wow.
Ever. Again. Ever. After she'd been treating them nonstop for 14 years.
Yeah.
One shot, one treatment, gone forever. There was another gentleman. This was a gentleman who had rectal warts and had 3 disfiguring, horrible surgeries. Yeah. And he came to me and did not want to have a 4th surgery. And I injected him 3 times. Gone.
Wow.
Never had another flare up again ever.
Is that a genetic disposition or
No, it's a virus. It's an infection. He caught it from someone and it just kept coming back again. There was a lady who had cervical cancer.
Okay.
Which 95% is associated with human papillomavirus. So I had a pharmacy compound a cream for me. We used a cream. She was going to go have surgery done, whatever. She used the cream for several weeks. I said, before you do the surgery, do this, go back. And she went back, gone.
Wow.
Gone.
No surgery needed. Wow, that's amazing.
So why is this not out there?
It's not FDA approved?
No, it's FDA approved.
Wow.
I'm using it off label, which is perfectly legal and fine.
Not for this.
Yeah. But why is this not being put out there? The first American doctors that published a research article on this was myself and Dr. Wilson from the ENT department at GW. Wow. And now it's common for the ENT world. It's common. In fact, it's funny. I went and saw an ENT doctor, and when we talked, and he said, "Wait, you're that doctor?" And she said, "Yeah. When I was a resident, we studied this, and this became common practice for all ENTs now. We don't laser anymore these tumors. We use the drug."
Wow.
In that world, it's become common, but the rest, why not in the dermatology world?
I know.
Why not on skin warts?
Wow, that's crazy.
So why is this information not out there?
Yeah.
I actually did on my, I think it was my Instagram, my Dr. Setari Instagram. I said, I want you to contact my office if you have the worst possible incurable wart. If you've got it, if no doctor's been able to treat you, please call my office. I am going to treat you and cure you for free.
Wow.
That's
free?
For free. That's my challenge.
Oh my gosh.
No, I want to do it. I want to do it. Because I saw an article a while back on some poor gentleman abroad whose entire body was tumors.
Oh, that's so sad.
And a doctor had volunteered to go, and they had done surgery all over him. This was like, I don't know when this was, like back in the late 90s or 2000 or something. If that guy had come to me, I wouldn't have operated on him at all. Yeah. I just would have injected these things. They just would have dissolved and gone away.
Yeah, because even if you do surgery,
no scar,
or potential to come back.
Well, right? Spread. The virus spreads by damage to surrounding tissues.
Oh.
Not with the drug. The drug kills the virus.
True.
It kills the virus. It doesn't damage healthy tissues.
That's amazing.
So why laser? Why burn? Why use acid? Why cut? Why freeze? Why do any of these damaging things that are 50, 100 years old? When here it is, this is 2024 for heaven's sake.
Yeah.
You have a drug right in front of you that you can use a cream or inject right into the lesion, and it kills the virus. It only kills the infected cells and does nothing to healthy cells.
Okay. So local. Okay.
Yeah.
Wow.
And we're talking, micromilligrams of this drug. Micromilligrams. I remember one time we treated this patient who had like a nasal papilloma or something, and we put in just a couple of milligrams, and a plantar wart disappeared.
Wow. From
that little bit that got absorbed into his bloodstream, it killed his plantar wart.
Oh, wow.
That's how powerful this thing is.
It's very systemic. Oh, that's amazing.
Yeah.
Okay, now I know which doctor to refer. That's amazing.
But this is just one example, though. I mean, there's tons of stuff out there that is either not being disseminated, this information, or some of it's actually being stifled.
Yeah. Is it only good for like external warts or?
Well, papillomavirus can only attach to certain receptors.
Okay.
So it doesn't really attach to like internal organs and stuff.
Okay. what was I thinking of? I think I was thinking of how women develop like polyps or cysts.
Well, those are polyps.
Okay, it's totally different.
Right. A papilloma was a different kind of a benign tumor due to the virus.
Wow.
Due to the virus.
Okay, so killing the virus directly.
Right.
That's amazing.
It is. It's. I remember one doctor who came to observe, and I showed him all this. He literally used the word flabbergasting. He said, "This is flabbergasting." Couldn't believe it.
Yeah. Does insurance cover this procedure?
It can actually. I had a patient who came in. I said, okay, and I wrote him a prescription for the medicine. They went to the pharmacy. They got the medicine. Insurance covered it. They brought it back. They covered the office visit. Everything was covered.
Wow. Yeah. Even better.
Yeah.
Oh my gosh. Yeah. Okay. Oh,
but
wow.
even if it's not covered, I've got the medicine in my office. It doesn't cost very much. What does it cost to come into the office and get injected?
Yeah.
$150, $300. That's what the dermatologist is going to charge you easily anyway, to go to his office and get stuff burned, frozen, get scars, spread the thing around.
Mm-hmm. And or worse, surgery.
Yeah.
Yeah.
Think about that poor guy who had 3 disfiguring surgeries, in his rectal area.
Wow. Okay. So besides the cosmetic surgery, the hair formula, and the what do you call this formula?
Well, no, this was just an example of cutting edge technology that is available but not being utilized.
Yeah.
Another one is prolotherapy. You know about prolotherapy. You and I have discussed this countless times.
Yes.
Today somebody has pain. They go to their doctor and he goes, okay, here's a steroid shot. One of the worst possible things you could do. Mm-hmm. Steroids are nothing. They're a Band-Aid for pain.
It's temporary.
Temporary at best. And in the long run, multiple research studies have shown it actually accelerates the damage. It accelerates the arthritis. It weakens ligaments and tendons and makes it more susceptible to further damage. When, if you actually draw your blood, spin down the platelets, get PRP, and inject that, it actually helps strengthen the area. Not only does it help with the pain tremendously, but it actually strengthens the area to resist further damage in the future.
Yeah. And you know this from self-experience.
I know it from personal experience, and many, many patients who I've treated and sent to doctors who have been treated with prolotherapy. Yeah. It's safe. It's not very expensive. The research is out there. It absolutely supports this stuff. Yeah. But no big pharma company can make money off of it because it's your own platelets. So nobody really pushes it.
Yeah, there's no sales involved, so there's no business to be made. Wow. Yeah, I think you would be it would be tremendous help if you did go out there and start. You were at a conference recently, like 2 weeks ago?
Yes. There I talked about the liposuction and how it's a dinosaur. Yeah. That is, traditional liposuction is a dinosaur. And no doctor really should be practicing that for their patients if they truly want to serve their patients and not themselves, their own interests, but want to serve
Did you talk about the quantum?
Their patients' interests. I did. I talked about the radio frequency, the new quantum, all of that stuff.
Yeah. So these were all plastic surgeons?
These were all well, some plastic surgeons, some dermatologists, but all cosmetic doctors, yes.
Oh, wow.
It was the beginning of my campaign.
Yeah. Did you touch on the hair formula also?
No, this was just on Ultra Sculpt.
Okay.
Just the liposuction stuff, yeah.
Yeah, I feel like everything that we discussed today needs to be heard out there.
Well, starting in 2025, I'm going on my crusade.
Yeah. Oh my gosh. I'm excited for you.
We'll see.
I'm excited for you. Any vacation coming up soon?
What's that?
He only has like one day off.
What?
Never heard of it. It's this guy works a lot, like 6 days a week.
I need some downtime.
Yeah.
Stress has been taking its toll on me. I do need some downtime.
At least 2 weeks.
Something.
And if you were to go, where are you going?
I love Mexico. Yeah. I really love Mexico. Cancun is beautiful. The people are just beautiful. They're beautiful people.
Yeah, so nice.
They're just so gentil. They're just so cordial. Such nice people.
Which part of Mexico?
Cancun. I love Cancun.
The
Cancun area. It's just beautiful. And all down that coast. towards
Have you tried Isla
Tulum.
Mujeres?
Oh, I love Isla Mujeres. Are you kidding me?
Yeah.
The island right off? Yeah, it's gorgeous.
Do you eat seafood?
I'm more of a meat guy, but I do love seafood. And the seafood there is fantastic.
Yeah.
It's fantastic.
I love Isla Mujeres is like a hidden secret
It is.
island.
It is. Isla Mujeres is gorgeous.
Yeah.
Absolutely
Tulum, I
gorgeous.
think it's like overpriced now.
Well, now it is.
If you've been.
Well, it's a shame though. It's so many American investors have gone down there that the local culture's been sort of overwhelmed.
Yeah.
And I was down there, and I was enjoying like the local culture and the local, sort of cart selling me like that dollar taco. And it's like nice and hot and spicy. And then I look over to the other side of the street, and Benetton. And I'm like, what are you doing here? If I wanted this, I'd still be in Beverly Hills, for heaven's sake. I don't want you.
Yeah.
I came down here to experience Mexico and the flavor of Mexico. Not Fendi. I don't want Fendi down here. If I wanted Fendi, I'd still be in Beverly Hills.
Wow, in Cancun? I didn't remember seeing that. I haven't been in a while, so.
Yeah. No, what Cancun? It was in Iscare. It was that far down south. It wasn't even Cancun.
Have you been to Cabo?
Playa del Carmen. What's that?
Cabo San Lucas? Is that what it's
I
called?
have been to Cabo.
Yeah.
It's
Americanized.
Yeah, I don't like the Cabo side that much. I went there once, and it was just.
They're selling real estate out there now.
Yeah.
It's kind of like California.
Yeah.
Newport Beach.
Yeah.
Yeah, it's not authentic for sure. Wow. Okay, so I wanted to. One of my girlfriends, she was talking about surgery, and of course I recommended you. But for some reason, she just shows me Instagram after Instagram of all these Miami plastic surgeons. Have you heard about those? Like, they'll post on there, like, I feel like they're trying to copy like Colombia, Brazil, plastic surgery, and they're saying we're cheaper. California is overpriced, blah, blah, blah. And I told her, I said, it's just a selling point.
So,
And I'm afraid for her.
Yeah, there are a couple of things you have to really be cognizant of.
Mm-hmm.
One is you don't want to go to a doctor whose office is a mill.
Mm.
Like for example, Florida literally had to change their laws. This is the first time this has ever happened, and they had to actually regulate the doctors in how many procedures they do and their hours, because there were so many deaths from the fat transfer to the butt,
from infection,
which I disagree. No, from embolisms, which I disagree with anyway. I always thought the whole,
it's very unnatural
Brazilian butt thing was it's just terrible. I stopped doing it in 2013, was it?
Mm-hmm.
I stopped doing it in 2012, 13.
Because you were afraid of complications?
No.
Or?
I just stopped doing it because I didn't think it was worth it.
Okay.
In my heart,
Mm-hmm.
I thought this isn't worth it for the patient.
Yeah.
And I just stopped doing it.
Mm-hmm.
Because the fat that you transferred, within a year and a half to 2 years, 70-80% is gone. Oh. So you're spending what, $8,000 extra on top of the lipo and everything else to get this beautiful, gorgeous butt that lasts about a year and a half to 2 years.
Does it like dissipate, or
and then the fat dies? It doesn't get a blood supply, so it just dies and then just gets absorbed.
Mm-hmm.
So what's the point of that? And then when it dies, nobody can control how it dies. It's not like
or where does it go?
It doesn't go away uniformly.
Mm-hmm.
Like this dies and then this doesn't die, and then that dies and then that doesn't die, and then this dies and then that doesn't die. So then now,
so it might be lumpy.
You end up with lumpy, bumpy butt for the rest of your life.
Oof.
So that doesn't make any sense either. Mm-hmm. So now you spend an extra $8,000 to get a beautiful butt that lasted about a year and a half to 2 years, and then could look worse for the rest of your life.
Yeah.
So I was, in my heart, I said, this is terrible. I'm not going to offer this to my patients. Yeah. And I just stopped doing it.
Yeah.
A couple of years later, it came out It's the single most dangerous plastic surgery procedure there is, period. Most deaths are from this thing.
Really?
And I was like, boy, am I glad I stopped doing this.
From the embolism.
Yeah, from fat embolism.
Oh my gosh.
And Florida, the doctors were doing so many from morning to night. They were doing them from like 7, 8 a.m. until like 9, 10 p.m.
Yeah.
And there were so many deaths that the Florida state government actually had to step in and regulate how many they were doing and, what hours they were working and all that kind of stuff. So, yeah. And Florida was the worst. It was the only state that had to do that. And so you have to be careful with, doctors who are kind of like acting as mills where they're just like conveyor belt churning patients out.
Yeah.
This is the whole liposuction thing. With my UltraSculpt, I can really only do one, maybe 2 patients a day. That's it.
Yeah. Yeah.
It's not general anesthesia. It's not
very
like
time consuming.
hit a button and they're out and then you go to work. It takes time to numb them up, make sure they're comfortable, to really contour the body the way you want, especially when you're using small cannulas, not big giant cannulas.
Oh,
so, it takes
is it average like 3?
It's more work for the doctor. It's a lot more work for the doctor. But it's safer for the patient. It's less traumatic for the patient. You get better. Imagine painting a room using a big giant roller brush or a fine little brush like you use for the corner, right? It takes longer, but it's more precise.
Yeah.
So again, are you servicing yourself as the doctor or are you servicing the patient?
Yeah.
See, that's the difference.
That's what I try
I'm not
to
a
tell
mill. I'm a concierge. I'm a boutique physician. I'm there to really take care of my patient. They're the paramount prime reason we're there is for that one patient. And that's who gets all the attention that one day.
Yeah.
It's not 4 or 5. I'm telling you, I know of many surgeons who are doing 3, 4, 5, 6 liposuctions a day.
Wow.
There are chains, which I will not mention, but they have like 40, 50, 60 offices all across the country.
Oh, okay.
And so a couple of their doctors applied to me to work for me, and I had to teach them my techniques. And I asked them, like, why did you leave them? And they said, because we got tired they were pushing us to do 4, 5, 6 patients a day. And they were good doctors. They said, you can't give these patients good care that way. I said, no, you can.
Yeah.
They were good doctors. They said, we didn't want to work that way.
They're just like in and out.
It's ridiculous. You can't take care of a patient well, give a patient good health care that way.
Wow. Is there a way to prevent embolism?
No, not really. I mean, there are a lot of things you can do to try to mitigate it. Do it under ultrasound, go above the muscle, not below the muscle, this, that, and the other thing.
Yeah.
But, as my best friend often says, life's a trade-off. You don't go under the muscle, it doesn't look as good, blah, 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 blah.
I see.
But here's what I do to get a nice sort of booty. You take care of the low back fat that's above the butt. And when this goes in, you get a great C curve to the butt.
Yeah.
Now the butt naturally pops out.
It's like a contouring.
Now the butt naturally pops out because you get a deep curve, lordosis to the spine, making the butt naturally pop out. And then you could use this device called M-Sculpt Neo, which builds the muscle of the butt, which is great. I mean, why do you want...
Muscle is better than fat.
I was going to say, why do you want fat in the butt anyway? It doesn't do anything for you. But muscle actually does work for you. Now it's easier to go up and down stairs and carry things and dance and do other exercise, whatever, So now you build the muscle of the butt. Now you've got a deep lordosis, a deep curve to the butt, and a more muscular butt. And now you've got a great looking butt, and it's safe.
Yeah. Yeah.
And it won't suddenly become lumpy bumpy for the rest of your life. So that's
the way you explained it just makes sense.
That's the way to do it, right?
Wow. Okay. So
that's an alternative.
For sure.
And safe.
Versus possible death.
Yeah, and there's a doctor I know who is the absolute guru on the mountain. The guru on the mountain for, butt transfer, fat transfer to the butt. I mean, his butts were gorgeous.
Yeah.
And he had a patient die on him on the table. And there was nothing he could do to save her. And she was young, like in her mid to late 30s.
From embolism?
Yeah, it wasn't his fault.
Yeah, yeah.
I mean, it was just one of those things.
Oh, gosh. That's scary, though.
Yeah, it was, well, horrible. You have to live with that for the rest of your life as a doctor. And
Yeah.
it's just horrible. I would never put myself in that situation.
Yeah. Okay. Now I see why you don't offer it.
Well, I stopped offering it originally because I just didn't think it was worth it to the patient. And then later when I found out how dangerous it was, like, thank God I stopped offering it.
Yeah, that's, oh gosh. Okay, yeah. So I would think, like, the cheaper it is, especially in Miami, you just have to be more cautious about their technique.
Well, if you live here and you go to Miami to get this done, now you come back here and you have a concern. Suddenly something is red and tender. What are you going to do?
Yeah.
You can call and do a virtual, but that doctor can't feel it. Can't,
True. That's true. And then with your patients here, you're like, they're in good hands.
Yeah.
You've got 2 locations.
I might tell my patient, look, I'll see you in a week for a follow-up. They call me 2 days later. They're concerned about something. I'm like, come in right now.
I feel like that doesn't
get them in the
happen.
schedule immediately.
Yeah.
And it's never anything, but I don't care.
Yeah.
I want them in now. I never take any chances.
Yeah. This is why he's my favorite doctor.
I had a patient worried that her stitches might have been coming out from her tummy tuck. It wasn't me. It was one of my doctors who had done it for her. And she came in and I said, that's not your stitch. I said, that's an ingrown hair.
Oh, gosh. So she got scared.
That's an ingrown hair, yeah.
Wow.
Or there was another guy. It was an Australian guy. This was a little bawdy, but he calls me up and he's like in a panic. I'm like, come in, what's going on? I didn't treat him. One of my other doctors has treated him, but he comes, he's like, Doc, look, my scrotum is huge and it's black. And I'm like, oh, okay. That's because we treated your pubic area and the fluid has nowhere to go. It's just fluid. It doesn't hurt, right? He's like, no. Like, it'll be gone in a week. Let me see in a week. It came back a week later, it was all gone.
Oh, really?
Yeah, but he doesn't know that.
Yeah.
So, but
it just takes a while
It's nice that I would, he came in, I was able to hold his hand, give him the reassurance he needed. I wasn't in Florida.
Yeah, you're right.
Sometimes that's all a patient needs is just someone to be there to give them the reassurance they need.
Between Los Angeles and Newport Beach, how many doctors are on board with you?
Myself, Connie, 4.
4?
Yeah.
Perfect.
Yeah.
I mean,
just right.
It's not a conveyor
Well,
belt.
what's great is the doctors I have with me are fantastic. They really follow like the ultra-sculpt technique exactly the way that I showed them. They're great surgeons. They're great doctors. I mean, they're caring human beings, and you can't teach people that.
Yeah,
So,
that's true.
Yeah, the technique, I mean, I can teach people technical stuff, but you can't teach people their heart.
Yeah.
And they've got great heart, and that's what matters.
Okay. Well, I'm gonna try to look out for your vacation pictures. I hope you actually book a trip because you need rest and so that way you don't need prolotherapy all the time.
Yeah.
I worry about you. You're such a hard worker but we're all lucky to have you available
cordial.
And nobody needs to go to Colombia or Brazil. Just go to Dr. Robert in Los Angeles.
Yeah, the thing is my prices are really very
Excellent.
well priced. Yeah, I mean, my patients go to Mexico like, oh, I spent this much. I'm like,
sometimes you get what you pay for.
I would have charged you that much if you came to me.
Yeah.
And I'm right here.
Yeah. I mean, now you know where to go. Thank you so much for coming.
Thank you. It was a pleasure.
Coming on your one day off. I feel so lucky.
No, it was a pleasure. Thank you for having me.
We'll see you again soon, and we look forward to seeing you next year to see what you're up to.
Thank you.
Bye, everyone.